How do you identify diaphragmatic flattening on a COPD X-ray report? Imagine looking at a chest X-ray and noticing that the shape of the diaphragm isn't quite what you'd expect. In healthy lungs, the diaphragm appears as a smooth, dome-shaped curve that rises into the chest cavity. But in COPD, especially when emphysema is involved, this shape changes. The lungs become hyperinflated, trapping air and pushing the diaphragm downward. This causes it to look flattened or even almost straight on the X-ray. To spot this, first focus on the contour of the diaphragm. Instead of a rounded dome, it will look more like a straight line or a gentle slope. The normal curve is smooth and upward, but in COPD, it appears flattened out. Next, check the position of the diaphragm. Usually it crosses the ribs between the 5th and 7th ribs at the midclavicular line. When flattened, it extends lower than this, sometimes beyond the 6th or 7th rib. Look for signs of lung hyperinflation too. The lungs will seem larger and more expanded, with more black areas indicating trapped air. You might see increased space between the ribs, called widened intercostal spaces, because the chest cavity has expanded. Sometimes, the heart appears smaller and is pushed upward, giving a floating look above the diaphragm. Large air pockets called bullae may also be visible in the lungs, further supporting hyperinflation. All these features together point to diaphragmatic flattening caused by lung hyperinflation in COPD. Recognizing this on a chest X-ray helps doctors assess how severe the lung overexpansion is. It's a key part of diagnosing and staging COPD, guiding treatment decisions. When the diaphragm is flattened, it indicates that the lungs are trapping air and pushing down on the diaphragm, impairing its normal dome shape and function. So, in summary, look for a straightened, lowered diaphragm on the X-ray, enlarged lungs with increased black areas, wider rib spaces, and sometimes a smaller, floating heart silhouette. These clues help identify diaphragmatic flattening and give a clear picture of lung hyperinflation in COPD.